I worked as a consultant breast surgeon for now about 20 years. Breast surgery is an incredibly rewarding subspecialty, but it can still be tough. For a time, all patients with breast problems were being transferred to me. This often took me away from general surgery operations, but this definitely suited me. Balancing clinical, research, teaching, and all of the admin that comes with the role. It's an endless fight for time. Resilience is key. I remember one morning waking up. It was a Saturday, and I was getting ready to meet up with some friends. I sat down for a coffee and opened my laptop, and I clicked on an email from my employer. It said that they were instigating formal disciplinary action against me, alleging that my general surgical operating techniques were felt to be deficient, and that my fellow colleagues were concerned about my post-operative complications rates and accusations that I may be de-skilling. I was restricted to non-clinical duties pending investigation. I just felt numb. They didn't really explain much about the concerns in the email. I spent the rest of the day questioning every decision I'd ever made. I immediately called medical protection for support and advice. Despite repeated requests from medical protection, the hospital refused to provide specific details of the allegations against me. I was left questioning my actions for weeks. We threatened court actions to compel them to comply with fair process. Then suddenly, out of the blue, they raised new fresh concerns in relation to my decision-making regarding patients with breast conditions. And I was completely suspended from my duties. Medical protection continued to fight my case, still threatening court action. Finally, the hospital particularized the allegations and supplied copies of the relevant patient notes. We now had the answers we needed, and we could start to prepare a written statement. An independent expert surgeon was instructed to review a selection of the case notes, and their main criticism was in relation to record keeping. Medical protection continued to engage with the hospital to ensure productive dialogue, and we helped them to understand the subtleties involved in managing breast cancer patients. With medical protection support, I also reflected on my record keeping to make improvements. The investigation found that the concerns didn't warrant ongoing suspension. Further threats of legal action forced my employer to lift the suspension, and I returned to clinical practice. It took 2 years for this case to reach its conclusion. I worry all the time. We wouldn't be human if we didn't. I worry about my patients. I worry about the care I give them. I also worry about the consequences should something go wrong in my practice. Adverse outcomes are sometimes unavoidable in healthcare. The support medical protection provided helped me get through the disciplinary investigation, which was the most difficult period of my career. It is a comfort to know that I can turn to them for advice and assistance, should something happen, whether, this is a patient complaint or being asked to provide a report to the coroner. This experience has made me a different doctor, a better doctor, I would say.